Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Misha Kogan, Chief Medical Officer here at GW Center for Integrative Medicine and Professor of Medicine at GW.
And I'm Janet Rodriguez, the office's Administrative Director. Today, we talk about the new book, Heal Faster, Unlock Your Body's Rapid Recovery Reflex, with author Dr. Victoria Maizes. She's an internationally recognized physician, author, and leader in the field of integrative medicine.
Drawing on 40 years of medical experience and cutting-edge research, Dr. Maizes shows that complete recovery is possible for a wide range of conditions when you know how to support your body's natural healing processes.
Dr. Maizes serves as the founding executive director of the Andrew Weil Center for Integrative Medicine. She is a professor of medicine, family medicine, and public health at the University of Arizona. She is also the author of Be Fruitful, the Essential Guide to Maximizing Fertility and Giving Birth to a Healthy Child. And she is a co-host with Dr. Weil of the Body of Wonder podcast, which you all should try and catch.
Welcome to GW Integrative Medicine, Victoria. You've been my mentor and a colleague for, 25 years.
Long time, yes. I remember we first met when you came to the then program in integrative medicine. I think you were still a fourth-year medical student.
I was still a fourth-year medical student. Life moves on. So now we are talking about your new book. It's right here. Everybody should have it. Should be a desktop, must-read kind of thing. So we're going to talk about the book, of course, but also I think we'll talk about some of your most recent clinical and research updates if we have time for it. But I think let's center on the Rapid Recovery Reflex. It's an amazing book. Well, let's start with kind of just the basics. How come did this come to be? I mean, I know it's a summary of 30 plus years of your clinical work, but how did you came up with the idea that, integrative medicine can be awesome, not just for chronic diseases, but for everything, including acute problems, which is, I think, what really triggered me to not just talk to you, but also realize, wait a second, we were missing a huge piece that you brought in with the book.
Thank you so much for having me as a guest. I think the book comes from a desire to make integrative medicine much more accessible. You and I know that there are still a relatively small number of us who are trained to practice integrative medicine. Some of the people who practice integrative medicine are full, their practices are full, or they have a concierge practice, which makes them expensive to access. They don't take insurance. And so I really wanted to make this large body of knowledge and my, as you said, almost 40 years of clinical experience accessible to as many people as possible. And that was the motivation for writing it.
You managed to weave not just your experience, but you also brought up a lot of really kind of the greatest research in there. And I know this has always been your passion, but doing this for acute problems, we are seeing, I think, ever increasing number of side effects from over-medicalizing our issues. And a lot of that starts with acute issues. And for me as a geriatrician, that probably speaks even more than for somebody who's in, say, pediatrics, where, we give people unnecessary medications in older age, and then we suffer all kinds of consequences. The health system suffers with the patient because things are overly expensive, et cetera. Walk us through just a couple of things that are closest to you in terms of specifics of acute problems. And then I have my own things that I want to bring up, but I just want to give you a floor first.
Sure. So acute or short-lived problems in general, they're going to get better. They're not things that you're going to live with for the rest of your life. So maybe the most common thing would be you get a viral infection, a cold. And in Western medicine, we don't really have much that we can recommend that would help support someone's immune system to recover more quickly from a cold. But in integrative medicine, we actually have a wide range of things that we can recommend. So as an example, there is evidence that zinc lozenges can be helpful at the very first sign. Now, zinc lozenges are very low doses zinc, about 5 milligrams, maybe 7 milligrams. So because the dose is about 25, you're going to want to be using one of these every 2 or 3 hours. But you know what? It soothes the throat. It actually feels good when you're using that zinc lozenge. There's some evidence, not super strong evidence, for vitamin C, but we know that more antioxidants like vitamin C eating more fruits and vegetables. There's evidence for garlic. Garlic has antimicrobial, not just antiviral, but also antifungal and antibacterial properties. And when my kids were young, garlic was one of my favorite things to give them when they had a cold. I would take a clove of garlic and press it, let it sit for about 10 minutes, and then I'd actually mix it into a little bit of cream cheese. So rather than onion and chive, my kids had garlic and cream cheese and, put it on a bagel, put it on a piece of toast, and they were just fine eating it, and it shortens the duration of that cold. But the other thing, and this comes from Ayurvedic medicine, is clean your nasal passages. So we all hate that feeling of being super stuffy and congested. If you go to sleep that way, you often sleep with your mouth open, then you don't sleep well. You wake up with postnasal drainage, then you have all this gunk you have to cough out. Well, if you use a neti pot to rinse your sinus passages, neti pot, sometimes a little challenging for people, so I often recommend a NeilMed sinus rinse, which is this little squeeze bottle that you put warm salt water with a little bit of baking soda that comes prepackaged, or you could make it yourself. And you squirt it in your nose and you get all the mucus out and you can breathe more clearly. Then there's less drainage and you feel considerably better. There's even evidence for that in terms of COVID, another viral infection, that it reduces the viral load, which either reduces the likelihood that you'll catch the COVID infection, even though you've been exposed, or have a milder case.
Use one twice a day.
Awesome. It's also really helpful for allergies. People have a lot of allergies to pollen or to animal dander or whatever it is. You're going to reduce that pollen in your nasal passages and you are going to have a better ability to breathe clearly through your nose.
Absolutely. Now, why is healing faster less about doing more and more about listening better?
Janet, I really love that question because a lot of times we just act automatically. Like, for example, say you have heartburn and you just automatically go to your cabinet and pull out some Prilosec or Omeprazole. It's over the counter, widely available, and you know what? It gets rid of that heartburn. But it would actually probably be better to pause and say to yourself, now, why do I have heartburn? And is it that I ate something spicy, something acidic, coffee, I had too much coffee, that disagreed with me, and learn from that experience? And so listen, get to the root cause, and therefore have less of that heartburn going forward. Maybe it was a stressful conversation that you had with your spouse or with a coworker, and that's why you have that heartburn. Maybe you ate right before you went to bed. And, when we're vertical, either sitting up or standing up, our sphincters work really well to keep the stomach acid in the stomach. But when we lay down, we don't have gravity on our side. And so it's a little easier for that acid to reflux. And so making sure that our stomach is empty when we go to bed at night by having about a 3-hour window is recommended. So thinking and listening to the body and trying to understand the underlying root cause of the symptom rather than just suppressing it with a medication is really supporting your body's recovery reflex.
Love what you just said, because people don't realize that if you're eating too close to when it's time to go to sleep, you're also messing up your sleep.
Yes.
So acid reflux on top of messing with your sleep cycle is bad news. But they would be surprised that, like you said, 3 hours, 3-hour windows, stop eating, probably stop drinking too,
Uh-huh.
especially when you've reached a certain age. You don't want to be up and down all night, and you will sleep so much better. But Dr. Maizes, do you know that listening to my body is how I figured out that I was gluten intolerant?
So I love that you're sharing that example because this is the whole premise of the book. The premise of the book is that if we pay attention, observe, listen, we will notice the things that are causing us a health challenge. And then we can remove, in your case, the gluten, which I would call like an impediment to healing. It's something that might have been, you didn't say what your symptoms were, but, maybe pro-inflammatory. It may exacerbate heartburn, as an example. It may cause skin rashes, brain fog, constipation. I mean, there's such a wide range of symptoms people get related to gluten. And when we pay attention, we then can remove that single, let's say, offender and be much healthier
And happier.
and happier.
And so just to tell you what my major motivator for staying away from gluten, sores on my tongue.
Oh, wow.
That took weeks to heal.
Wow. Yeah,
So
so interesting. I
no
also
gluten.
avoid gluten, and I had a rash on my elbows. That was it. A little eczema on my elbows. And I thought,
Mm-hmm.
but if it's doing this to my elbows, what's it doing to my gut?
Absolutely. Because that food allergy connection is real, y'all.
Absolutely. Interesting you brought the sore mouth because my next question was about herpes. So in the first chapter, you bring up this 30-year-old woman. And by the way, the whole book is structured around a clinical cases, right? So there's a case and then how you approach the case. And I love how you weave together not just the natural methods, but, the patient had to get medication for a while until she got a lot better. So
Right.
this is the true integration. We're not about, one method or the other, but coming in together, but then turning this acuteness into the management of more chronic situations, preparing the body to deal with the acute issue. So talk a little bit more about kind of how do you weave this acuteness and the chronic illnesses and help people to induce the healing reflex across all the states. So it's not just about acute problems, it's about everything in chronic conditions as well.
Yeah, I actually avoided the word chronic in the book. I called that section long-standing, and I did that because chronic implies that you're stuck with it for the rest of your life. Chronic pain, chronic condition like heart disease or diabetes. And I think the distinction that I made in terms of these might be things that have been around longer, but also they often take longer to reverse. So in some sense, the longer you've had something, back pain as an example, the longer and the more effort you might have to put in to fully recovering from it, as opposed to that cold, which if you do nothing in 5 to 7, at most 10 days, you're going to be well. So these conditions often take more effort. And sometimes in our culture, the message is, that's it. You got that diagnosis, you're stuck with it. So I really like for people to have the evidence of when these things may be reversible and where integrative medicine can help. So you're a geriatrician, Misha, and there are conditions I'm sure you see all the time that I don't cover in the book because I think our evidence that you can reverse them, fully recover from them is much slimmer. So one place I do talk about is type 2 diabetes. Many people learn they have type 2 diabetes and they leave their doctor, their nurse practitioner's office, and they have this sense of, that's it. Now, for the rest of my life, I have diabetes, and my uncle had it, and this bad thing happened to him, and, I'm doomed kind of thing. And really, as one example of a long-standing condition that can be reversed, diabetes can be reversed, and it can be reversed in a wide range of ways. So I give this example in the book, a patient of mine who did not want to have diabetes and said, what else can I do? And I talked to him about options. And where I lived in Northern California at the time, there was this very popular physician named John McDougall who recommended the McDougall diet, which is essentially a vegan diet. And my patient followed the McDougall diet. And I say that because when you go to restaurants, there would be little labels on the dishes that were consistent with the McDougall diet, the way now you have gluten-free or vegetarian. So he did, and over the following months, he reversed not just his diabetes, but he had about 40 pounds of extra weight. He had high blood pressure. He had elevated cholesterol. And all of these things got better when he followed a vegan diet. Now, in the United States, we know not everybody wants to follow a vegan diet. That's not the only option. We also know that in some sense, the opposite of a vegan diet, which would be a low-carb diet, a lot more fat, some protein, very little carbohydrate, also has been shown to reverse type 2 diabetes. Another strategy, which actually completely steps away from what you eat to the timing. So Janet, we were talking earlier about not eating 3 hours before you go to bed. There's a concept of time-restricted eating, where you limit the number of hours that you eat during a day. And this has been studied. They're not huge studies, but they've been studied and shown to help people reverse type 2 diabetes. As an example, usually it takes about 14 hours. So that might mean that you stop eating after 7 p.m., you could still have a glass of water. You could still have a cup of tea with no sugar or honey. And then in the morning, 9 a.m. is the time that you can begin eating again. And when people follow time-restricted eating, they reset their metabolism and their diabetes is sometimes reversed. They have other health benefits. It turns out sleep is not just this passive activity. When we have our good night's sleep where we're not got a stomach full of food, we're also rebooting our immune system. We also are laying down memories, consolidating memories, and creating a healthier brain for ourselves. We are supporting what's called autophagy, which is essentially programmed cell death of old, ineffective cells. So there are so many positive things that happen when we honor our body's biological clock, our circadian rhythm, which says that there are more effective times for eating. Morning is probably best, but late at night, not as good for sleeping. And that does depend a little bit on what we call your chronobiology. So there really are, people who are morning larks and people who are night owls, and their bedtime will be a little bit different. But honoring our body's clock is one of the absolute secrets to being healthy and to restoring health if you have been unhealthy.
Misha has done both, right?
Yeah, it's funny you brought up an intermittent fasting because, today is a strange day for me. I haven't had my breakfast, so I've been fasting and I will keep fasting until probably another couple hours. So we have to practice what we preach.
Yes, yes. And, when I first started looking at the science, which is relatively new, and that's one of the things I really enjoyed doing in Heal Faster, you alluded to this, is that there's a lot of science supporting this, and it takes a long time. It's estimated it can take 17 years for an innovation that's been research proven to actually get into clinical practice. So when I first started reading about time-restricted eating, I realized that often I only had 9 hours where I wasn't eating because I had this, I'm going to call it a bad habit, where I'd walk through my kitchen to the bedroom. And as I went through the kitchen, my hand would just automatically reach for some chocolate-covered almonds. Now, that's not necessarily bad for me, but it wasn't good for me to have at 9 o'clock at night. So I haven't given up dark chocolate covered almonds. I just eat them earlier in the day. And now I'm really conscious of stopping eating so that I have that 3-hour window. And so that I usually do a minimum of 12 hours. And sometimes I do 14 hours or longer. But I think for all adults, a minimum of 12 hours, unless there's some health reason or your blood sugar's dropping. I'm not saying it's 100%, but for the vast majority of us, a 12-hour overnight fast with a 3-hour window before you go to sleep is going to be a healthful step.
You will sleep so much better.
The words of experience.
Yes. So you noted that taking melatonin the night before surgery it's talking about sleep and things that we do for sleep. The night before surgery can lower a patient's post-op opioid needs. What are some other surprising remedies in your integrative medicine toolbox for surgery prep or just for life in general? What are some of the things that when you tell this to a patient and the patient does it and they're like, it worked.
Yeah.
It worked.
So you're alluding to the section of the book that talks about preparing for an elective surgery to have a better outcome. And there's a whole concept that's, again, relatively new called prehabilitation, in which people really begin to consider what are the things I do in advance of that elective surgery to promote a better outcome. And I think especially important, again, in geriatrics, because in geriatrics, more than any other time of life, we wrestle with frailty. There's a percentage of people, and it's a pretty significant percentage, who are malnourished. If you're malnourished, you don't do as well with surgery. There's a As we age, our protein needs go up. And yet, often people's appetite isn't so great and they're not eating enough protein. Well, surgery induces what we call a catabolic state, which is the breakdown of lean body mass or lean protein in the body. And so you want to be sure that ahead of surgery, you have enough protein. How do you know? Well, there's different ways. There's ways of measuring your body mass, your body composition, so that you can actually see how much lean body mass you have. There's a blood test for albumin, which helps assess your protein status. And these are helpful if you've had unexpected weight loss. That can also be a sign that you're not well nourished in advance of your surgery. So you're going to want to have that conversation with either your doctor or your surgeon in advance, and then you're going to want to prehab. You're going to want to make sure that you're getting extra protein and getting that albumin normalized. You're going to want to make sure that your blood sugar is under good control. So if you have prediabetes, if you have diabetes, the better your blood sugar control is, the better the outcomes, for example, from orthopedic surgery. So a hip replacement, a knee replacement. You're going to want to get your muscles strong because after surgery, you've got a surgical wound to deal with. It's a little harder to get up out of bed. So physical therapy before surgery, especially if, say, you are having a hip or knee replacement, you may need to use a walker or crutches. You want to learn how to do that before the surgery so you're not also dealing with a painful replacement that is limiting your mobility. So all of these things fall into the prehabilitation. Then, like right before surgery, you gave a great example, melatonin. There's evidence that melatonin the night before surgery reduces your need for opioids after surgery. There's evidence for things like peppermint aromatherapy. One of the side effects after surgery is that people suffer from nausea from the medicines or from the anesthetics. And so peppermint turns out to work, smelling that peppermint aromatherapy in just 2 minutes. And even our wonderful intravenous Zofran medicines can take up to 40 minutes. So the peppermint, having a little vial of essential oil with you that you can use after surgery. There's other essential oils like chamomile and lavender and sandalwood that help with that post-op anxiety. So you want to have that on hand. You may want to have some guided imagery on hand to help quiet the nervous system and calm you and help you put you in a relaxed state. You want to be sure you have your social support lined up. Who's taking you to the hospital? Who's bringing you home? So all of these things fit into the category of prehab or preparing to assure your best possible outcome.
Fascinating. I have not heard this term. Prehab? Is that how you pre?
Yes,
I was just
rehab. Yeah, but instead of rehab, which is
right.
after,
Prehab.
it's prehab, which is before.
I mean, I've been doing this always, but I just never gave it a name and sort of structures. This is awesome.
I'm sure you have, because I'll say the same for me. I am not a surgeon, and yet for all the years I've been in practice, my patients have said, I'm having surgery. Is there anything I should do? And 30 years ago, I came across the work of like Peggy Huddleston, who wrote a wonderful book that was about preparing for surgery and healing faster. And hers was all focused on guided imagery and hypnosis and things that could be said to activate the mind-body response. But over the years, I've also learned the importance of the physical, so the nutrition and the body, the muscles and the structure to make sure that that is really well ready. And then, of course, over time, the social support and the impact of social support.
Well, this was so wonderful, Victoria. It's so great to have you with us. Again, the book is titled The Heal Faster, Unlock Your Body's Rapid Recovery Reflex. It's now everywhere, Amazon, wherever you prefer to get it from. I think everybody should have this book.
You just have to type in Heal Faster in Amazon and it says Heal Faster in your name. So it must be flying off the shelves, as to say.
Yeah.
Well, thank you so much for having me as a guest, and I really appreciate it. And I do want your listeners to know there are things that you can do to heal faster.
Well, thank you so much for sitting down with us, Victoria.
All right, friends, that's For this is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Misha Kogan.
And I'm Janet Rodriguez.
Thanks for listening. Great.
Thanks so much for having me on. It was fun.
This was awesome. Yeah.